of Nemours, and I'm here today to talk about transition services and transition to the adult world. And I'm talking very, very generically on purpose, knowing that you guys are from all over the country. And so the goal is that when you leave today, you'll have some tangible things to take back to wherever you're from and know who to connect to and what to do to start supporting our young adults to be as successful as possible as whenever they are ready to rise to that occasion, or maybe even for yourself. All right, so, and then we'll have some time for questions hopefully at the end. This is being videotaped, and then I'm also willing to give my presentation out so you guys will have access to that as well. But if you're a person who wants to take pictures with your cell phone, knock yourself out, all right? So just to be really quick about the differences of why we actually had to focus on transition. Transition is more than just the focus from the school system. And a lot of times when people hear transition, they think, oh, it means aging out of the school system into whatever exists. In my life at the hospital, we have a program where we're actually talking about medical transition of helping young adults move from the pediatric-centered world to the adult-centered world, but then also all of the other supports and services that go along with that. And so just to help frame that, I'd like to just kind of briefly go through pediatrics and what we do in pediatrics, and then how the rest of the world is going to be for the rest of your child's life as an adult or for your own life. So in pediatrics, right, we're very family-centered. You have a beautiful hospital like the one we're in right now where everything's colorful and friendly and everyone's super engaged. The expectation is that you're developing over time. So you know, with a pediatrician, you start as a little baby and you're this big, and then eventually they're, over those 18 years or so, are making sure you get to be a full-size adult. And so they're really working on being very prescriptive and saying this is what we recommend, and everyone's involved in this discussion. Once someone moves to the adult world, which you guys are all hopefully consumers of adult health care, it's very, very different. And the expectation is that patient, that individual is going to be the one who's autonomous, who's making their own decisions and in control of their lives. The reality is that none of us are ever totally independent and in control of our own lives, right? So we have all kinds of support people and family members and caregivers who help us along the way. But it's important to talk about preparing young adults to get to that level of autonomy to the best of their ability, so that way it's not such a culture shock. Because the expectation from the adult providers is going to be, you know your stuff, you're able to answer these questions, your mom's not making the phone calls anymore for you. And people who are not prepared, it is an abrupt, like, what kind of moment. And so we have this focus on transition to help be the building blocks to talk about having people become the best possible adult. So that was kind of my talk about medical. Really quickly. All right, so the goal for transition, if you look and ask people what transition is, it should be a guided therapeutic process. So it's not a one-time event, and people sometimes get transition and transfer confused. So transfer is the actual, literally one day you have Dr. Smith as your pediatrician, and the next day you have Dr. Jones as your internal medicine doctor. That's the transfer, it's just an administrative thing. Transition is a process, and it's building blocks and working on skills over time. And so there should be really no surprises in transition planning. We don't want to have people say, oh, I had no idea, because it should be an ongoing discussion, and if you're not already having discussions with your healthcare providers, it should be something you should be comfortable bringing up to say, what are we doing to make sure we're increasing someone's self-advocacy and ability to manage themselves? And sometimes you might even find some things out about yourself that you're like, oh, that was helpful. So focusing now, really talking about kind of the adult world and adult non-healthcare systems. What I do at the hospital is focus on how is someone going to live their life the 363 days a year they're not visiting doctors, actually. And so today, very generically, talking about the continuum of services, one of the questions I always run into, I ask people is, where are you going to live? Where do you live right now? Who do you live with? And then where are you going to live in the future? And a lot of times, young adults are still living at home with parents or caregivers. And a lot of times, the discussion, though, is, I think I want to move out. And sometimes the parents are shocked by that. And sometimes the parents are like, get out, that's a good idea. So it depends what's going on. And it could be a different, depending on each day, too. But so for everybody, and with XY variations, right? That's the idea of a variation, is that we have people with all kinds of different characteristics and symptoms of that. And so if your child has intellectual disabilities or some sort of learning differences, developmental disabilities, then in your state, no matter what state you're from, you definitely want to have them registered for their developmental disability services. So it could be called DDD services, IDD services, MHMR services, just depends on what state you're from. But the reason is that in the adult world, the entire adult world for people with intellectual developmental disabilities is set up with those people being the gatekeepers and kind of the umbrella to funding streams for services. So if you're a young adult, wants to move out of your home, or if you're a young adult and you want to move out of your parents' home, if that person's going to need some sort of residential support, so whether having a staff person who comes in just to make sure they took their meds, or somebody to help get them from transportation from their home to their job or whatever, you want to be registered with that disability agency, okay? There are wait lists for those services in the entire country. And sometimes I work with young adults who are 19 or 20 and I say, so do you want to live at home? They said, well, next year after I graduate at 21, I'm going to live in a group home. And I say, great, are you registered with the agency? And they say, what's that? So it's a 10-year wait list, at least, for residential programming. Some places around the country it's 25 years, which is like before you even know you're pregnant, thinking like potentially, maybe I need to get on that list. So if you look at a state like Delaware, actually, Delaware's Division of Developmental Disability Services now says they don't have a wait list anymore. They have a registry, which is a list of people in order, which looks very much like a wait list. So semantics, right? So registry, wait list, whatever. People need to be registered with the Developmental Disability Agency if they have that, meet that criteria of having cognitive disabilities as well. And there's a huge range of programs out there, from individuals living by themselves and having staff people come in to support them, individuals living with other young adults with disabilities and having some part-time staff, full-time 24/7 group homes, all the way to institutional care facilities and everything in between. There's adult life sharing programs, there's like adult foster care, so there definitely are programs and services out there. And afterwards, when you go home and you digest all this, you'll have my contact information. Send me an email. I'll tell you who I can connect you with in your state to help facilitate those discussions. Educationally, if your child has an IEP in school under federal law, by the age of 14, there should be a written transition plan in place as part of that IEP meeting. Now, I've been around a long time doing this, and I can tell you that in a lot of IEP meetings, the discussion for transition planning is, we'll talk about it next year. And we'll talk about it next year. And then suddenly 19 or 20 happens and we're like, oh my gosh, what are we going to do next year when they age out of the school system? So it's important to really be the one who maybe is guiding that discussion to say, wait, what's it going to look like in 4 or 5 years or 6 years for my child as they make the move out of the school system? People who have an IEP under federal law are allowed to stay in school, receiving services from the school district until the year they turn 21 if they're still working on their IEP goals. And I've worked with a lot of families who have children with XY variations who don't know that. And it seems like sometimes the school district is really interested in pushing somebody through, because that's what they do. And it's important to say, hold up a minute, wait a minute. There are areas here where we're working on executive functioning, on independence, on self-management. These are all things that can become part of an IEP, and that someone could be working on those goals. Equally, just because someone's staying in the school system until 21 doesn't mean they have to be in their traditional high school program. So there's lots of places around the country where a school district might pay for someone to go to community college or go to a technical school. The school district's footing the bill for it. They're still registered in the traditional school system, but they're not actually in that regular high school anymore. So there's definitely options out there, and people need to understand that they can advocate for that and can fight back and say, you know what, we really think these extra 3 years are critical for developing the self-management skills and making sure we're working towards setting our child off on the right path. So definitely feel comfortable in pursuing that. Every state has educational advocate agencies, so parent information centers are usually framed around that idea, and these are actually all the people who are there to help you with understanding what your rights are under federal law and IDEA. There's also a session later on about IEPs and 504 plans tomorrow, I think, during this conference, so I definitely recommend people go and learn more about that in a more formal capacity. But just know that if you have an IEP, you can say, wait a minute, I think it might be important to have those extra 3 years of education. Earlier, I was in session before in independent living. Someone asked about certificate programs, or if someone's not graduating with a high school diploma. If you have a high school diploma, if your child academically is going to meet the state standards for an academic diploma, but they want to stay on in school for those 3 more years, they can do that still too. And so what happens is they go across the stage of graduation, they refuse their diploma, so they don't actually accept the diploma from the school district, and that still entitles them to receive those extra years of funding to support their IEP goals. If someone takes their diploma, then that means they are saying, I am done with the traditional school district paying for things for me. And that's like you're closing that door and you can't reopen it. If someone does not have a diploma track but going on a certificate track, then they are absolutely entitled to stay in school until 21 and work on those goals. If a young adult is interested in going to college, earlier someone had mentioned vocational rehabilitation next door. So Voc Rehab, every state has an agency of vocational rehabilitation. These are places that are set up to support people with barriers to employment. So it's kind of a broad topic and what that means. So barriers to employment could be someone who has executive functioning issues, someone who has autism, somebody who has cerebral palsy, someone with XY variations. It depends on each individual person. But Voc Rehab, the reason it's important to know about them is they help with things like job trials, job assessments, interviewing skills, knowing your rights under federal law for employment, helping pay for college for students. So if somebody has qualified for Voc Rehab services, oftentimes they'll pay for college tuition for people. Again, nice to have someone else foot the bill if possible. If you're young adults interested in going to college, one of the biggest shifts is that in college, you're not followed under IEP or 504 plans anymore, and now it's based on eligibility versus entitlement to services. And people get used to the model they've had over the years of being entitled to appropriate accommodations under federal law. College world is different. Now it's the burden of proof is on that young adult. And as awesome as you are as parents, if you think you're gonna call the professor and say, but my child needs help, they're gonna laugh and hang up actually, because it's just not how it's set up. The entire rest of the world is going to be saying, this young adult needs to be able to advocate for themselves and be able to explain their own things, obviously with supports in place. So every college has an Office of Disability Support Services, might have some names similar to that. That's where you would go in and you would have a meeting in advance and say, look, in school I had an IEP or a 504 plan. This is what kind of accommodations I had. This is how it worked for me. This is what I need. And you have to have your young adult go in and provide that burden of proof. They have to be able to do that. A lot of times the analogy I use for young adults, because a lot of times by the time they get to college, they're like, you know what? I'm sick of having people know anything about me. I'm gonna start fresh. I don't wanna have that label anymore, that disability diagnosis. And I try to use the example of the analogy of a seatbelt. So hopefully every day, every time you get in a car, you put a seatbelt on, right? Because that's just the safe thing to do. You put it on every day. Most days you don't need that seatbelt. Does nothing for you. But the time that you get into that car accident and your seatbelt saves your life, you're like, that's why I have my seatbelt on. The same thing by going to the disability office ahead of time and disclosing your disability. You may never need an accommodation in college, but if you get into that finals week and you're cramming and you're like, I'm so overwhelmed, I need a break, I need an extension, you can go, oh, I have that seatbelt. I can use that accommodation now. If you wait until finals week, you haven't disclosed anything, and you go up to professor and say, hey, I need an extension, they're gonna say, yeah, you and everybody else in the class. Right? So we really want to encourage young adults to be willing to, they don't have to have a giant sign that says I have XY variations or whatever on their forehead, but they need to go in and be comfortable explaining that to people. And obviously, you guys are all very familiar with this. If you tell somebody, I have XXY or whatever, they go, what? No one knows what that means actually. So what we try to do is to encourage people to be able to explain what that's similar to. So a lot of young adults I work with have conditions that are similar to autism. Right? And so if you can explain that people know what autism is generally, and so if you can say it's similar to autism, this is where I need some supports, people go, oh, okay. So just be prepared that no one's going to actually know. You say Klinefelter, no clue. So most people, the rest of your life and your child's life, will never know actually what that means, but you have to be able to explain it to people and have them understand and get comfortable explaining it to people. One of the biggest differences if you go away to college or your child goes away to college is to think about how they're going to actually manage their life now. They've been in probably a relatively protected environment, living at home and having supports and people at school who knew them. In the college world, if you're living in a dorm, you're now in a new routine. You've got classes at different times of day. You've got to figure out like, how am I gonna get to the dining hall? What's my priorities? One of the things we run into a lot of times is if someone is taking medications, like for ADHD or something like that, those medications have a street value. And so when you go to a college campus, it's something we talk about. We say, how are you going to protect your medication? Because it's a controlled substance and you're not going to get more if after 30 days aren't lasting 30 days. And we've had people where they went to go get their medication to take it and it was gone. So we talk about like actually strategies about like lock boxes or not telling everybody, hey, guess what I have in my room? But also how do you get your refills at college? It's different. You're used to having your parents pick up the pharmacy and now you go away to college. How are you actually going to get them? Is there going to be a pharmacy local to campus? Is there going to be a mail delivery? And how are you actually going to have it in a timely manner? So thinking about all of those things. FERPA is the law that's around protection of privacy for educational things in the college world. And so again, like if you went to call the professor, they're not going to tell you anything. Even if you're paying for your child's tuition, they don't have to tell you a single thing. And actually, they're not allowed to unless your child gives permission. So just be prepared for that, because sometimes that's a rude awakening. There's a phenomenal website called thinkcollege.net. So next door, there was a discussion about the college living experience program. ThinkCollege.net is a list of the different programs around the country, the entire country, that are designed for students with learning disabilities and/or intellectual disabilities in post-secondary education, both traditional four-year colleges, two-year associate's degrees, but also certificate programs. So if somebody wants to have a college experience and academically is not going to go get a college degree, there are programs that are called TIPSs now, transition programs in post-secondary education, that are all around. There's like 7 of them now. University of Delaware actually has one where people go for a 2-year certificate in college. They get to take some classes as an auditor, but then they also get to take it as do things around mentoring and job training and being part of the social clubs at the college campus, all that kind of stuff. And the program at UD actually this year is starting a dorm component, because we had a lot of students who went through the program and said, that was awesome, but I really miss out on not living in a dorm. Like, I feel like that's part of what I wanted to go to college for. So they're actually starting to do that now. Those programs are often funded by Voc Rehab. So again, another reason to get connected to Voc Rehab services. Someone had asked next door about what do you do if you're not getting a diploma and how are you going to pay for that? Voc Rehab is the great connection for you. So Voc Rehab also has a checks and balances system in every state. So if you're not getting services that you think your child should be eligible for, entitled to, or actually eligible for, then you could connect to somebody in your checks and balances from Voc Rehab side to advocate on their behalf. I can connect to that too. If your child's not going to college or isn't interested in college right now, which I don't think college is the answer for everybody. I think some people are like, I have no idea, and then at 40 they're like, I want to go to college now. Whatever works for you is going to be great. So there's a continuum of vocational options and job programs out there. Again, depending on if your child qualifies for those IDD services, there might be extra services beyond what Voc Rehab would be offering. So day programs are really social recreational life. Workshops are people getting paid on a piece rate basis and are falling out of favor, and there's fewer and fewer of them around the country. There's supported employment with job coaches. There's competitive employment where someone might have an assistant come in for the first couple days to help establish relationships with their peers, and then fade out of the way. Other times they might have a job coach with them, for a month or 2 at a time. Everything in between. There's an option out there for your child. I don't expect people at 18 or 19 to know what they want to do for the rest of their lives, and you're allowed to change your mind. That's part of being a human being. And so sometimes I find that in the disability world in particular, people get told, well, everybody that we've worked with goes to this program. Well, yeah, but if that program isn't what your child is interested in, then you need to say, that's great for all those people, but this is what I actually want. And again, working on the self-advocacy and promoting, what do you actually want to do? What are you interested in? What are you good at? That's how we all have managed to be successful as adults. We're still working on that, I guess. Insurance and financial matters. So this is just something, and later on there's a talk about government benefits that I would recommend that you go to because it's going to be more in depth. But generally speaking, the CHIP, the health insurance program for children, ends on the patient's 19th birthday usually. Again, generally speaking, in many states, if a person is going to qualify for SSI as an adult, supplemental security income, then they typically in most states will also qualify for Medicaid as an adult. Now, as of yesterday, right, we live in a very interesting world with insurance right now, and paying attention to all that stuff. So there's we're in this kind of chaotic, not sure what's going to happen, what the future looks like with insurance and Medicaids right now. So it's just something that I advise all my families I work with to be paying attention and understanding what the implications will be if Medicaid gets capped in the states, but then also the implications for commercial health insurance through parents as well. Right now, under the Affordable Care Act, young adults can stay on their parents' insurance until 26. It used to be you had to be a full-time college student. But so right now, that's how it stands. Depending on what eventually gets passed, we want to make sure people are paying attention to those kinds of issues around being able to stay on parents' insurance until 26, denial of pre-existing conditions, lifetime maximums, all of those things, because it has an impact on everyone's future that way. So just pay attention to that stuff. Just to go back really quickly, if your child's going to qualify for SSI as an adult, in order to do that, that's using the adult definition of disability, which is essentially could the person work 20 hours a week competitively in gainful employment, give or take. In order to qualify for SSI, you have to have your assets under $2,000 at all times. So stocks, bonds, savings accounts, anything. So if you have a child who you think in the long run may not be able to be competitively employed, and may qualify for SSI, then I would really recommend that you do what's called special needs estate planning. And that's sitting down with someone who's a specialized financial planner who understands the nuances of the laws around government benefits and eligibility. So right now there's 2 different ways that someone can save more than $2,000 and still be eligible for SSI. So the most common, well-known thing I think is called a special needs trust. Again, set up by an estate attorney. So you may have a friend who's an attorney who's awesome, but you want somebody who specializes in special needs or elder law to do this. So a special needs trust, you could leave retirement accounts, life insurance policies, real estate, any of that kind of stuff could go into a special needs trust, and your child could still be eligible for SSI. There's also now an option called an ABLE account, which is like a 529 college savings plan, but for someone with a disability. Special needs trust doesn't have any kind of limitations in how much is in there, so it could be millions of dollars. An ABLE account has an annual maximum contribution of $14,000 and a lifetime maximum of $100,000 before your SSI is impacted. But again, there's going to be a discussion later on about that. Yeah?
So I think the ABLE account?
So the ABLE account, it's another way to save money, but it's got an annual limit of $14,000 and a maximum lifetime of $100,000 before it would impact someone's ability to get SSI. The money in the ABLE account is kind of, I would say it's probably easier to access versus a special needs trust. But again, a special needs estate planner is somebody who can go through the details with you and talk to you about what you need and what works for you. Most special needs estate planners will do a free confidential intake to talk about, look, this is what we suggest, this is what we could offer to you, and then you could decide what works for your family. A lot of times people will say, well, that's great, I don't have money to put in a special needs trust. And so instead what they'll do is they'll write it into their will that upon their death, a special needs trust is created, and then the estate funds the trust. So like if you have life insurance policies where you want to leave money to your adult disabled child, you could change the beneficiary to become the special needs trust of Bobby Smith, if your child's name is Bobby Smith. Otherwise, don't leave it to Bobby Smith. Some people are paying attention, that's good. But you could leave that, the special needs trust of Bobby Smith could be who that goes to, and that way Bobby could still remain eligible for government benefits like SSI and Medicaid. So 2 different types of special needs trusts. Okay, so there's a first-party special needs trust and a third-party special needs trust. If somebody has a first-party special needs trust, that means that it is money from that individual with a disability themselves. So if there was like a lawsuit or a settlement, money in their name, when that person passes away, the money in that trust goes first to pay back Medicaid for anything that Medicaid has paid in their lifetime. Okay? A third-party special needs trust is not the individual's money. It's family, friends, anybody who's been like over the years for holidays want to give money or something. The third-party special needs trust, not the individual's money directly. When that individual passes away, the money goes back to that person's estate to distribute and does not have to pay Medicaid back. So there's a difference between the 2. So a special needs trust is supposed to pay for anything that SSI is not paying for. So SSI is supposed to be paying for like your very basic monthly needs, clothing, food, shelter, those kinds of things. So people who have a special needs trust might use it to pay for modifications to their home, might pay for an accessible vehicle, might pay for vacation, all kinds of things. The special needs trust, there's an executor of that trust, which could either be a family member, oftentimes it's a corporation or somebody from the bank who's in charge of that trust, and you have to petition the trust to get money out, versus an ABLE account, which is more like a bank account that someone could go get the money out of to be used on things that are towards working, clothing, any of those kinds of things. So if it's a first-party special needs trust, then the money that's left over when that person dies pays Medicaid first. If there's money left still from there, then it would go back to the estate to distribute.
But now, let's say when he's living and we need to take money out to help whatever.
Yep.
First party trust.
Either way. So either kind of trust is a valid trust. It just depends on how it's set up, where the money came from originally, as to what happens when the person dies. And again, this is where you want a special needs estate planner who that is what they do legitimately. I just give a lot of advice about what I know. But you want somebody who's going to be able to sit down with you and say, look, based on our state, there are pooled trust options. There's lots of different things out there. So you want somebody who's a special needs estate planner, though, for sure. Okay. Legal status change. I get a lot of families who come into me and are like, oh my gosh, on the 18th birthday, we're shut out from my child's life. I can't access information. What are they going to do? They're not able to be self-sufficient yet, which most 18-year-olds aren't really self-sufficient, right? Most 20-year-olds, 25-year-olds aren't self-sufficient. So typically, generally in the US, it can, depending on your state, you might be 18, 19, or 21, depending on your definition of legal adult. Generally, at 18-ish, somebody becomes legal and adult, where the expectation is they're now able to consent for things and sign legally binding contracts and documents, all that kind of stuff. HIPAA also takes effect for them on their 18th birthday, which is the patient privacy law. So the idea of HIPAA is that technically, if a parent wants to call and talk to a provider after their child turns 18, technically the provider should say, oh, sorry, Sally's now over 18, I need her permission to tell you anything. I would say that in most pediatric systems, people may not always pay attention to their patients turning 18 or 19 or 20, and so sometimes they might just be really comfortable with the family and might just share information. Technically, after 18, they should be saying, wait a minute. So parents freak out a lot of times about, I'm the one who's helping them manage everything, and I'm not gonna have access anymore. So the good news is that that's not true. Okay. So first thing what I would do is I would go back to your law, to your state that you live in, and see if you have what's called a health surrogacy law. So the health surrogacy law, some states have it, not everyone does, basically says if someone's over the age of 18 and in the moment they're determined to not have the capacity to make a decision or understand something. So it could be they're really sick, intellectual disability, they're unconscious, whatever that reason is, if in the moment the two doctors can say this person isn't able to make the decision, their next of kin automatically makes the decision for them. And the hierarchy is usually spouse, adult child, then parent. So if you have a young adult who has intellectual disabilities and you're worried about being shut off at 18, I would check your surrogacy law in your state and see if it's valid for you. So that's a passive thing because it happens automatically. So for anybody in this room over the age of 18, if your state's a surrogacy law state and in the moment you didn't have the capacity, then your next of kin would make your decisions for you if you haven't done something formally. So the formal thing would be a healthcare power of attorney. And this would be a document that somebody over the age of 18 signs that basically says, I'm giving certain people permission to talk to my doctors, to access my medical information, and to help me make decisions if I can't make a decision in the moment. So it doesn't take away rights of that person. The person still has to be the one who consents for treatment or surgery or anything like that. But it says, like, yep, it's okay to share information with my mom. I'm telling you this is who it's okay to talk to. Or my dad, not anything just for moms. So you can get it for free for every single state. So it's part of an advanced directive, which is about end-of-life decision making, which most people aren't like at 18 aren't usually thinking about, but it's still important to know it exists. So you can get a power of attorney, a healthcare power of attorney that way in your state. You could also go to an attorney who might draft a healthcare power of attorney and financial power of attorney, depending on your situation. The healthcare power of attorney does not require an attorney to do, though. So you could print it off right now from your state document. It could either be notarized or witnessed by two people who are not part of your child's healthcare team, so neighbors or friends or somebody. And then once it's notarized or witnessed, then you give a copy to all the doctors' offices, all the providers, and they know it's okay to talk to. It's a living document, which means it's completely editable and voidable. So what I usually say is when someone's 18, we're like, all right, cool. Right now, if your insurance company sent you a denial and they said, here's a bill for $14,000, would you have any idea what to do with it? And most young adults are like, no clue. They're like, I give it to my mom. I'm like, yes. So that's why you want your mom to probably be able to talk to the insurance company on your behalf. But so since it's editable and voidable, I say start out by putting your parents down or whoever those people are in your life. But then if you get married someday, you can write void on that copy with your parents and put your spouse's name first or whatever. You can change it up, but anytime you change it, just make sure you give a new copy to all the providers. So anybody over the age of 18, everybody in this room should have a healthcare power of attorney done. If you don't, just go back and do it. The other option would be a guardianship. So guardianship would be going to court and having your child be determined to be legally to not have the capacity to make decisions for him or herself. So it's a permanent decision that can't be reversed. So it'd be legally removing someone's rights and saying they aren't able to make a decision. We're going to give the powers to this person, usually a parent in a situation. The only way a guardianship can be reversed is if the person has a miraculous recovery. So if somebody's in a coma and they come out of the coma, you could say that's a miraculous recovery. If someone has an intellectual developmental disability, there's not a miraculous recovery from that. So once a guardianship's in place and it's permanent. It's important to understand that once a guardianship's done, because the person's now being determined to be legally not to have the capacity to make their own decisions, that's a permanent decision. So when the guardian dies, somebody else has to be listed as the guardian. And if they don't, then oftentimes that person becomes a ward of the state. So somebody from the state then makes the decisions for them. And so in my clinic, we're up to almost 1,000 young adults I've worked with. I would say the vast majority of parents who have been thinking about legal guardianship get told by the school, you need to get guardianship because the school doesn't know the options. And then once they hear what the permanency of it is, they go, that's not what I want. I just wanted it for a few years to help until he's like more mature. So guardianship won't give you that. I'll give you the caveat. Some states have limited types of guardianship. Okay, so again, you have to go back to your state and look at it specifically. But so for the state of Delaware, as an example, we have guardianship of person, property, or both. So person is the day-to-day decisions, where someone's living, all that kind of stuff. Property is all financial matters, and both is the whole kit and caboodle. A state like New Jersey has limited guardianship options. So you could have a person who has a guardianship only for medical decision making. Okay, so it depends on your state. The concern, though, would be if somebody from New Jersey, just as an example, has guardianship for medical decisions, they move to the state of Delaware, we don't have a limited option, so therefore the state of Delaware would honor it as a full guardianship, most likely. So it's just important to understand the nuances of the law and to talk to somebody before you make a decision. I've worked with families where the parents have already done something, and then afterwards they say, I didn't know, I had no idea, and I'm stuck now. And I've worked with a young man who's like 26 now, and his mom said, he's so mad at me that I have guardianship over him. And I was like, well, you were coming from a place of caring, but this is going to have a limitation on his life and what it looks like for his future. So it's just important to kind of have the conversation. It is in my opinion, very easy to get a guardianship of someone. I could essentially get guardianship of any of you right now, actually. It's really, really, really easy. Because what happens is you would file paperwork, and then a physician has to fill out an affidavit that states, it doesn't say, does this person need a guardianship? The physician affidavit says, as an example in the state of Delaware, it says, does this person have some issues where they may not always be able to make the best choices? Well, yes, that's called being a human being, right? So all of us could do that. So it's really, I've had young adults where they're in college, living on their own independently, going to go on and have full families and full careers, and the parents have guardianship because someone told them to, and then they don't realize the person can't sign documents, they can't get a marriage license, can't do a credit card application, can't get a mortgage, nothing, their signature is not valid for anything. I think as more and more people are paying attention to young adults surviving into adulthood who need supports, et cetera, that I think that people are starting to go, oh, the surrogacy law is important, it takes effect, but also systems of support are in place. So the DD agencies are set up recognizing that people who have a developmental disability need supports. And there could be family members, it could be paid staff, friends, whoever. And so I think that guardianship in the next probably 10 years, 20 years start to fade out as being seen as a need. And so I don't mean to upset you, I'm sorry. But no, so there are some places that have the limited option. It's just important to understand the totality of what you're doing, because if you don't have an option of a limited thing, it's a permanent stuff that can't get reversed. We have people who like to fight it and don't have a way to fight it because it's been determined. So anyways, here. And it costs money to do guardianship. And we have families who spend thousands and thousands and tens of thousands of dollars to do guardianship. But anyways, all right, I just want to get to some fun stuff now. All right, so in order for all of our young adults to become successful adults and ourselves, we have to be focused on having young adults become self-managers. And there's no age that's too early to start in this process. So even if you have a baby, there are still ways that you can have that young adult, that child, really get more active in their care. So no matter where you are right now, you can start from this point on and work on these areas. So the reality is that we learn things, right? That's how we experience life, is through practice and trying things. And how do you ride a bike? You fall off a few times, you get back on, you fall off again, you get back on. How did you learn the stove was hot? Your parents probably told you that stove burner was hot, but the way you actually learned that was that you touched the stove burner. And so kids with disabilities need to have that same option for experiences too, and not just have people do things for them all the time. Because then they get into a situation where the expectation is, you already know how to do this, and you're like, I've got no clue. So what we try to say is, people think kind of osmosis, like you just watch it happen and they suddenly know how to do it, and it's not. We really have to be very, very prescriptive in what we're doing to help support our children become self-advocates. So it's like eating an elephant, which seems like it's a really big deal. But you eat an elephant one bite at a time, and so you work on self-management skills one bite at a time as well. So here are the areas that I try to focus on developing, areas around personal care, medication management, healthcare issues, and that way these are hopefully things you can go home and be like, oh, this exists. So day-to-day things, can someone cook for themselves? Do they know how to make a 5-course meal? I don't really care if they can do that actually. Can they make a bowl of cereal? Can they make a sandwich if they need to? Can they survive a bachelor lifestyle of making some kind of food? Yes, great. If not, then let's start working on that. Some people are really scared about using the stove. Can you use a microwave instead? What could you do? And encouraging your young adult to do those things. Laundry. We have a lot of young adults who go away to college, and first 3 weeks in, they're doing great, and then all of a sudden they're like, oh, I probably should do some clothes. Some clean clothes might be helpful here. And they go down to their laundry facilities in their dorm, and they're like, this machine has all these buttons, and I have no idea what to do with these buttons because the parent has always done laundry for them. So what I try to encourage young adults to do, or parents to do, is to start to say, hey, it's because I love you that I'm making you do these things. You need to know how to do this yourself, actually, and like how to care for yourself in the event of an emergency. So sometimes people don't know there's all kinds of assistive technology and devices out there to help people be more independent. So just as an example, so this is a tool that could be used to reach the back of a stove if someone's either short or uses a wheelchair. This kind of things exists and very readily available. This is a food chopper. So sometimes parents are terrified of their child using a knife and cutting things up because they might cut themselves. So like a food chopper is really easy to push. The other secret thing to help people cut food is a pizza cutter, which can cut through almost anything, and they make them all different styles and grips and stuff. And so if you're worried about like you getting your child using an actual knife for things, then a pizza cutter is a great resource. This is a hard plastic container to help put a carton in. So cartons are squishy, which I think are hard for anybody to use. But if someone has difficulty with dexterity, this is a thing that has a handle. There's also make one with a fulcrum that can pivot to pour things out. This is a spatula that you're all going to go home and get. Oh, hold on. So this, you squeeze the handle and it rotates the thing for you. So like your pan, see? Yep, I hear it all the time. Literally, I could sell those and make a ton of money because everyone's like, that would be so helpful. So, and then, now this is the part that, there's not really any young adults in here, no offense to anybody, but I was like, if there's like a teenage person, I'd be like, yes, there you are. So the best predictor out of all the research around transition, all the idea about people becoming adults, all that kind of stuff, the best predictor of someone being gainfully employed is if their parents made them do chores. Well, so the idea is, right, the expectation, it means like, hey, I think you are capable of something. You have to contribute to the household, and you have skills that are useful to other people. So even for my young adults who have physical disabilities, I always show them this, and they get mad at me because they're like, why do you tell them that? So this is a dustpan and broom that actually has a forearm crutch built into it. So for someone who has cerebral palsy or something like that, like it exists out there. These things are all available so people can start to work on, hey, I'm contributing, I can do something, and go out and actually get a job someday too. So every state has assistive technology resource centers, and there's a link here that you can, again, you're going to get the slides, but so every state has these centers that actually loan you equipment. You can take it home and try it out for a few weeks, see if it works for you or for your child, because it's so annoying to buy something and you spend a lot of money on it, or you asked insurance to pay for it and they finally approved it after all those letters of medical necessity, et cetera, and you get it home and you're like, that didn't work the way I wanted it to. These AT resource centers allow you to take something home. You go in for a meeting, you say, this is where I need help with things. They're like, here, take it home, try it out, see if it works for you. And if it does, then they either have an assistive technology specialist who can talk about how to get it funded, whether insurance pays for it, or they say, well, you know what? So this is the special needs version, but Walmart sells it, the non-special needs version, which is the same thing, for $14.99. So anything that's labeled special needs is going to cost 400 times more than the non-special needs version. Excuse me. But areas around personal care, communication, educational supports, independent living, all those things are readily available at these AT resource centers. And depending on how big a state you are, you could have several of them. So like a state like Pennsylvania has like 7 or 8 different AT resource centers. Delaware has 1. We have 1 in each county because we're like this big.
Including communication assist devices through school.
Absolutely.
That maybe the school won't advocate for you, but you could.
Correct.
If
So.
doesn't like to write.
Love it, yes. So a lot of times people have been assessed for communication interventions and assistive technology when they're very young, and at the time they're determined to not be a good fit for whatever reason. And what I find is a lot of people don't go back and get revisited in another speech evaluation to say, all right, so technology has evolved, I've matured as a person and I have more skills now, what else can I be using to help me communicate effectively, whether through communication apps or through Dynavoxes or things that record something for you or dictation, all kinds of things out there. So if you're having a difficulty with the school, I would first off say you could probably work on advocating to fight that. But if you want to go a different route, then these AT resource centers have all kinds of things out there. We have apps on our iPad that I show in the clinic all the time. It's a free app. It takes 2 seconds to set up a button and I can have anyone communicate with anyone. So lots of different things out there. Other areas that we want people to know about are medication things. So why do I take this medicine? What happens if I don't take it? What if I miss it? What are the side effects? Who prescribes it? In our clinic, we actually go through every single medication with every young adult and their family. And a lot of times parents are like, well, yeah, we know this. And I'm like, yeah, but your child doesn't know it. They've been sitting here for 19 years and you've done the talking. And now they're going to go into this world where people are going to say, what are you taking? It's a yellow pill. So we don't know what's that yellow pill. And then also encourage people to take those medications independently. So a lot of times we talk about medication reminder apps. So if your child has a cell phone, which most kids nowadays do, there are hundreds of different apps out there. There are apps that can send you a text reminder at the right time. This one here actually shows you the actual medications you're taking and a picture of them, which is helpful if someone has a hard time remembering which is which. So medication reminder apps, there's many different options that way. There's also things like pillbox reminders. So this is more the traditional kind, which is like the Sunday, Monday, Tuesday, morning and afternoon. This one, the blue one up there, actually has a clock built into it. So you would have like your 8 different times that you'd be taking medications, and it could have an alarm going off in your pocket. The bottom one is for an entire month's supply, so depending on how, what works for you. This next one you're gonna want to run out and get. This one is called the timer cap. So this is actually helpful, especially if you have family members who are aging or have dementia. It tells you the last time how long it's been since the bottle was opened. So if you have someone who takes medicine once a day, take one pill once a day, and you go over and it says it's been 36 hours since they took their medicine, you know it's been 3 days actually. So there are things like this available to help be like, you know what, you're in control, but I want to just make sure that you have the supports in place to help you be as independent as possible. It's going double. The left here, the pill case, a lot of young adults, especially when they go away to college, the new routine, I'm rushing from the dining hall to my 8 o'clock class. Do I take my meds? Did I take them? Do I not take them? What happened? This is a pill case that plugs into your smartphone jack. And so this is at Walgreens for like $4.99, I think. And so you could actually have, like if you take a morning med and your child often forgets to take it right away, then they could have it with them in their, now they have to remember to put it in there, so that's a different issue, right? But they could have it with them, and then when they're in the middle of class, be like, oh yeah, I forgot to take my meds this morning, and take them. So there's also this blue box, which is hard to see actually. I'm sorry, I'm gonna mess up your moving here. But so this is a cardboard box, and inside it are these plastic containers that are like vacuum sealed. That it's called Pill Pack, and it actually will give you a little envelope for each time you take a med. So Monday 8 o'clock meds, and then Monday 12 noon meds, and Monday 3 p.m. meds, and it's all already in there, and they come in a month's supply on a huge roll. So that way people who are taking several medications, also helpful if you forget. You can check, if you're going away for a weekend, you can just grab the Friday afternoon till Sunday night roll of meds and take it with you. And some of you might be thinking, I might get that for myself. Just guessing.
You package it and vacuum seal it?
No. So it's called pillpack.com, and it's a robot pharmacy, actually. I want to say New Hampshire. Commercial insurances usually pay for it. Medicaids have not been paying for it, as far as I am aware right now. So they have real humans there too, but it's all done through the system, and it comes in a monthly supply to you, and they refill it. Obviously, like if you take an inhaler, they're not going to have the inhaler in the pill pack that way, but it's really helpful for people who maybe spill their pills a lot or have tremors, that kind of stuff. Sometimes young adults feel like parents nag them. Never happens. I know, see? What? So what I try to do is talk about strategies that young adults can agree with their parents to not be nagged. And so sometimes, you may be like, oh, have you taken your meds? And they say yes, and then you forget that you asked the question, or you just want to make sure, so you say, hey, did you take your meds right now? Did you take your meds already? And they feel like they're being nagged. So we come up with something very, very basic. A calendar on the refrigerator, on the kitchen counter, wherever it is. You take your meds in the morning and you put a check mark. And that means, so the young adult has to put the check mark. That means if they don't put the check mark, that is them giving you an invitation to say, hey, I noticed there's no check mark. Did you take your medication? But if there's a check mark, it means you can't say anything to them, because you're agreeing that you're going to follow this protocol now. We have young adults who are away at college, and the parents are calling them every morning to remind them to take their meds. Okay, so we're like, okay, so how about instead you text them a thumbs up every morning by 9 o'clock that says you took your medicine. If they don't get the text, they're going to start calling you. Just be prepared for that. So trying to figure out ways that we can empower that young adult to be a little more involved in things and not have you feel like you're giving up total control, but you're supporting that. So everyday things. So For me, I plug my cell phone in every night, so my medication is right by my cell phone charger, because I can guarantee that I'm going to have my phone plugged in the morning I take medicine. By the sink in the morning. People make their bed sometimes every day, so if you're a person who does that, you can put your medicine by your bed, and that works for you. Brush your teeth, any of those things. So what I always say is, if your child knows how to use Facebook or Twitter or Amazon or iTunes or any of those things, they have the skills to get more involved in managing their own healthcare, because it's just using a different website, okay? So, refilling prescriptions. Most commercial pharmacies have an app now to refill prescriptions. You literally go to the app, you scan the barcode, and it refills it for you. You don't talk to a person, you don't type in 16 numbers, none of that stuff. It just does it for you. It also, you can set up text reminders that say it's a 30-day medicine, 24 days into it, it'll send you a text saying, do you want to refill this? And you just text back the Y for yes, and it does it for you. So again, empowering young adults to do things for themselves. And I do always like to remind people that cell phones do have the capability of actually being a telephone too. Like, you can call the pharmacy on a phone. I would never do that, but it is possible to do that, and you could actually refill a prescription that way too. So healthcare things, knowing your medical history, your family's medical history information, checking yourself into an appointment. We are in the habit at the hospital, especially in the pediatric world, of just talking to the mom. Hi, Mom, who's here today? And I'm like, no, like, your 16-year-old can say, hi, I'm Bob Smith. I'm here for my appointment with Dr. Jones. Like, my kids were 2 and 4. They always laugh because they would go up and do that. Because I'm like, they know their name, they know their address, they can do this, because it's showing them that, hey, this is you as your own individual person. You're in control of this, and the rest of your life, people are going to want you to know how to do these things. So health history forms. Young adults, the first time they go to an appointment are going to get this, and they're going to have no idea who has what in the family. So we say, like, a family holidays or some kind of function, to actually kind of write out a little family tree of what people with medical issues they have, but also important to know what are people who are no longer alive, what medical issues do they have, and then take a picture on your cell phone. I don't actually expect anyone to remember anything, but use your phone, use the photo capabilities, so that way when they go to an appointment, they can expand that and say, oh yeah, great-grandmom did have high blood pressure, and so does great, Uncle so-and-so. So that way they can keep track of it themselves. Medical alert options. So if you have a child with any kind of medical issue, that would be helpful in an emergency to know. And again, even with XY variations, if your child has tendencies that are similar to autism, I would not resist the idea of saying autism on a medical bracelet, to help people understand in an emergency what that means or what that looks like for somebody. So lots of different options out there: paracord, beads, silicone. The kind you don't want to waste your money on is one that has a flash drive, because of the fear of viruses. If you come into an ER with a flash drive with your medical history on it, we can't use it in an ER. We can't plug it into our computers because they're worried that it's going to be infected with something. So don't waste your money on a flash drive unless you're always bringing a laptop with you in your emergency, which probably isn't going to happen. So instead, get a bracelet or get a necklace or something like that. A lot of times we have people who have tactile defensiveness issues and don't want to have a bracelet on, and that's not going to work for my family. So we talk about different tools and strategies, like they make temporary tattoos now that you can get printed with anything you want. So like Staples sells the temporary tattoo printer paper that you can get anything printed on, but then also you can order from a service online that could say, XY, whatever, allergic to latex, and your phone number. And maybe not put it like directly in the hand, depending on where you're going. Shoelace medical alert options, so things that tie into the shoes and you have to worry about.
Just microchip on one, you're on that.
So that would not be found to be very favorable. I get a lot of people who ask about getting medical tattoos, and I'm like, if you want to go open a business, go do that, because people are like, oh, it would be so much easier, I just got it tattooed on me. So there's options out there. Also labels that go in clothing. We have young adults where they have issues with maybe potentially wandering or getting lost and not knowing where they are. And so we talk about other ways that aren't microchipping, but to help maybe keep track of somebody or help somebody get back home in the event of an emergency. So no teens nowadays carry a wallet, because that's just not cool and that's not what teens do. But teens all carry cell phones. So I say go get a cell phone case that has a wallet feature in it. So that's one that slides out. They make cell phone cases that like have a portfolio so that it opens up, whatever it is. I actually I have 2 examples in my 2 cell phones. So like a lanyard people could wear around their neck. If you use a wheelchair, there's ways to put it on your seatbelt, all that kind of stuff. So, but if you have a cell phone, have a way to carry your state ID with you and your insurance card and that kind of stuff with you all the time. And then check with your state to see if you have what's called either Register Ready or Smart 911. So this is a service through the emergency medical services where you can actually give them medical information about anybody in the family, and that way if a 911 call comes from that phone number or that address, it pops up for the dispatcher ahead of time. So they know that they're going to a house of somebody who uses a wheelchair or somebody who has seizures or whatever, and that way they can plan for it. Also, we have people where, if they are blind and they're saying, just run out the door, like that's not going to work in a fire. You need to go in and actually get that person. So you can do any of that kind of stuff. I think eventually every state will have this as a registry, but not every state does right now, so you can check yourself. And then really quickly, just I want to open up, every iPhone, if you have an iPhone or your child has an iPhone, every iPhone has a health app on it that actually allows you to store medical information for emergency purposes. So it's probably the app that you've passed through a million times, and you're like, why is this on my phone taking up space? It's a little red heart in a white box. What happens is if your phone is locked, which your phone should be locked, right? Someone finds your child, they're unconscious because of an emergency or something. Someone finds the phone, they can hit emergency on the bottom screen. It pops up to give you an option to call 911 on that screen, or if you fill out their health app, it gives you an option that says medical ID in that bottom corner. Right there. Oh, see, I'm hooked up, double mic'd. But I caught it though, it was good.
Every Apple device comes with that already?
Every iPhone has it on there, on the health app, yep. So you would hit medical ID, and then it goes to that read-only screen that shows them only what information you put in there. So you put blood type in there, you can put organ donation status, you can put emergency phone numbers, whatever it is. It's on every single iPhone. If you have an Android phone, there are apps you can download that would break into your lock screen for that purpose. But I would definitely recommend it. And then EMS people can also, if they come upon an accident scene, can look on someone's phone and do that. It's also a way to get your phone back if you lost your phone somewhere, because someone can hit emergency and medical ID and call that number and say, I'm in Target and I found your phone. Otherwise, you have a phone you're not getting back. All right, so by 16, everyone should carry information with them, ID card, insurance card, state ID, not a school ID, a state ID by 16, or a driver's license, depending on your situation. Insurance cards, make a photocopy if you're worried about them getting lost first, and then eventually, once you know they're there all the time, make sure they have the real insurance card. Important people phone number, and then medication allergy list. So we have some videos about these topics that obviously are more in-depth than a quick presentation, but they're actually of real people with disabilities in the state of Delaware and different programs that exist, because the families I work with oftentimes say, well, there's programs for those kind of kids, but not for my kid. And I'm like, no, there are programs for your kid, I promise. So one on legal and financial planning, one on what will I do after high school, that's different job options, that kind of stuff in college, where will I live, different residential programs, and then taking more responsibility and trying to increase self-advocacy. They're all available on the YouTube channel from No More's as well, and you guys will have links, obviously, to them. And then we have 2 more videos we got funded through the Genetic Alliance, actually, for people with genetic conditions. So we have Planning for Your Future and Understanding the Laws and some programs around genetic conditions, and then Family Planning and Genetics, which is something that's really important. And the topic of sex and sexuality is something that gets avoided, like the plague. And then people get into an adult world and adult relationships, and they haven't had any education. So it's so important, especially we find if kids have an IEP in school, they often don't get traditional health class or sex education. They get pulled out for therapies during that time or whatever, and people go, well, it's not really important. Like, it's actually really important. One, because everybody's a sexual being. We all have hormones. But then also, there's a really high victimization rate of people with disabilities, and so people need to understand, like, this is my body and how to protect yourself and that kind of stuff. So I'd really encourage that if your child has not gotten sex ed, to reach out to me. There's lots of resources out there that are vetted and like legit, but to encourage the school to actually be honest and open about those kinds of things. Resources to know in your state: Development Disability Agency, Voc Rehab, Educational Advocates, Family Voices. Every state has Family Voices, which is a national grassroots organization run by parents who all have kids with special health care needs. So they're huge, helpful people because they've all been through the system before and can tell you, don't waste your time calling that person. They're never going to be helpful. Call this person instead. And then every state has university centers for excellence in developmental disabilities. It often have lots of different programs.